Welcome to this session on One Health. The concept One Health was introduced at the beginning of around 2000s, but this is an idea which we have been knowing for more than a century. One Health implies that human health and animal health are interdependent and bound to the health of the ecosystem in which they exist. This concept is implemented by the World Organization for Animal Health, OIE, as a collaborative global approach in our understanding of the risks for human and animal health and ecosystem health as a whole. It calls for the intergovernmental standards through publication of the worldwide information on animal health and through a network of international experts and programs for strengthening national veterinary services. It collaborates with more than 70 international organizations which play a key role in the human animal ecosystem interference. And today, you know, uh, we know that in the post 1980s, there is a rise in the number of zoonotic diseases because of varying reasons. And around 70 to 85 percentage of the contagious disease affecting humans are zoonotic. So this implies that while investigating the etiology of disease strategic approach, we need to incorporate scientists from multidisciplinary sources, and only that will provide an efficient way of addressing those ailments. And One Health implies the collaborative efforts of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and our environment. If we try to understand the context in which we talk about the significance of One Health, we know that there are many factors that have changed the interactions between people, animals, and planet. In the recent decades, human populations are growing, and they're expanding into new geographical areas. This results in more people living in close proximity with wild and domestic animals. And animals play a very significant role in our lives, be it for food, fiber, livelihood, travel, sport, education, or companionship. And our consumer patterns have also changed in terms of our eating habits. A taste for exotic species has also have an impact on this. And the close contact with animals and their environment by humans provide more opportunities for the diseases to spill over from animals to people. On the other hand, we also need to think about climate change. A change in climate and a change in the land use pattern, for example, the deforestation or the intensive farming practices. Any kind of disruptions in the environmental conditions and habitats will also result in condition for diseases to pass from animals to humans. And one third dimension which we need to remember is the increasing rate of movement of people, animal, and animal products across borders. This international travel and trade results in a quick spread of diseases across borders and around the globe. So that is where we need to understand why epidemiologists observe a rise in the number of zoonotic diseases since the 1980s. Be it rabies, be it West Nile virus infection, or anthrax, or Ebola, or presently, COVID-19. And also remember, when we talk about One Health issues, it includes zoonotic disease, antimicrobial resistance, food safety and food security, environmental contamination, and other health threats shared by people, animals, and environment. And One Health is gaining recognition across globe as an effective way to fight health issues at the human animal environment interface. It voices for involving experts in human, animal, environmental health, and other relevant disciplines and sectors in monitoring and controlling public health threats and to learn about how diseases spread among people, animals, plants, and environment. Only then we can think about an effective approach. So, in this context, a successful public health intervention requires the partnership of professionals in human health like doctors, nurses, epidemiologists, public health practitioners, professionals in animal health like the veterinarians, the paraprofessionals or agricultural workers, and environmental professionals like ecologists or wildlife experts, and also people having other areas of expertise who are capable to communicate and coordinate activities. When we think about One Health and the actors involved in that, it also talks about the role of policymakers as well as the communities, because One Health believes in this core principle: when we protect one, we help protect all. So that is where we say that people who protect the human, animal, and environmental health through coordination, collaboration, and communication help to achieve the best health outcomes for people, animals, plants, and our environment. The Centers for Disease Control and Prevention in the United States comes up with a clear modules for us to understand this concept of One Health. That is where they discuss the various One Health issues and also the way how we are trying to address it. So the key point here is working together is the key to One Health. It involves everyone. So it is not just in the United States that this idea became very prominent. We just now, discussed, uh, you know, about the World Organization for Animal Health, WHO, and other agencies. How they came up with a tripartite agreement to act together to attain this goal of One Health. A little bit about the history of this term One Health, this concept of One Health. So since 1800s, scientists were noticing the similarity in disease processes among animals and humans. Although human and animal medicines were practiced separately until the 20th century. So Dr. Rudolf Virchow, who was a German pathologist, is credited with coining the term zoonosis to indicate an infectious disease which is passed between humans and animals. He was also, a strong advocate of, voicing for the importance of an improved veterinary education. Taking one quote from Virchow, between animal and human medicine, there are no dividing lines, nor should there be. The object is different, but the experience obtained constitutes the basis of all medicine. We also need to um, remember another person, William Osler, who is the father of veterinary pathology. He was a Canadian physician uh, in North America. He was the person who trained people like Dr. Virchow. So one of his earlier publication was on the relation of animals to man. And he, in 1889, became the first physician in chief of Johns Hopkins Hospital and played an instrumental role in establishing the Johns Hopkins University School of Medicine. Now, a little bit about how a veterinary public health division was, established under CDC, the Center for Disease Control and Prevention in US. Dr. Steele recognized the important role of animals in the epidemiology of zoonotic diseases, and he believed that good animal health is important for good public health. So that is why he started this veterinary public health division. And the introduction of this public health division initially in USA was gradually spread to other parts of the world also. Then in the next phase, we can see Dr. Calvin Schabe, who coins the term one medicine. In his monograph in 1964, he proposed that veterinary and human health professionals should collaborate to combat zoonotic disease. And it was in his textbook, Veterinary Medicine and Human Health, that the term one medicine came up. And in this work, he was talking about the similarities between human and veterinary medicine and the need for a collaboration to effectively cure, prevent, and control illnesses which affect both humans and animals. So, this was a very significant step. And in the year 2004, the Wildlife Conservation Society held a symposium on building interdisciplinary bridges to health in a globalized world. So, people who attended the symposium discussed, about this how this diseases move or spill from, animals to humans, and they came up with a set of 12 priorities to combat the health threats to human and animal health. And the outcome of this symposium was the coming up of the Manhattan Principles, which calls for an international interdisciplinary approach to prevent diseases, and this becomes the base for One Health, One World concept. Before moving to the principles provided in the Manhattan Principles, a bit more on the history. In the year 2007, representatives of around 100 plus countries and around 30 international organizations attended the International Ministerial Conference on Avian and Pandemic Influenza in New Delhi. So the governments were encouraged to further develop the One Health concept, and the shared understanding was in terms of building linkages between human and animal health systems for pandemic preparedness and human security. And it was in the following year, in 2008, that One Health became a recommended approach and a political reality. In the next ministerial conference on the pandemic influenza held in Egypt, a strategic framework for reducing risks of infectious diseases at the animal human ecosystem interface was officially released. And in response to the recommendations of this 2007 ministerial conference, which was held in New Delhi, organizations like FAO, OIE, WHO, UNICEF, and World Bank, along with UN System Influenza Coordination, came together to develop a document titled Contributing to One World, One Health, this strategic framework. So it was basically based on the lessons, we learned from, H5N1 avian influenza response during the early 2000s. And this One Health concept became a strong approach to address the emerging infectious diseases at this animal-human ecosystem interface. And in 2009, the Public Health Agency of Canada hosted um, a conference, or it was an action expert consultation. So in this technical meeting, they were discussing this one world, one health strategy, and came up. They came up with few key recommendations, and that is how gradually there emerged a serious attempt to advance this concept of one health. And the 2010 International Ministerial Conference on Avian and Pandemic Influenza, held in Vietnam, confirmed the need to bring a greater attention to the link between this human animal health, and the participants adopted the declaration that called for a focused action at the animal human ecosystem interface and recommended for a broad implementation of One Health. And now, the OIE, FAO, and WHO came together to publish the Tripartite Concept Note in 2010. And this Tripartite Concept Note proposes for a long-term strategic direction for international collaboration aimed at sharing responsibilities and coordinating global activities to address health risks that arise when there is a close interface between humans, animals, and ecosystem. In the same year, um, the United Nations and World Bank released the fifth Global Progress Report on Animal and Pandemic Influenza, where they reiterated the same ideas. And in the following years, you can see nations, adopting this One Health approaches, and currently the ongoing pandemic, the COVID-19, made us to again strongly emphasize the need to have One Health as an effective approach to combat and to address these such zoonotic diseases. Now a bit on the major principles, which is popularly known as the Manhattan Principles, because this forms the core of this One Health approach. So the Manhattan Principles recognizes that to win the disease battles of the 21st century, while ensuring the biological integrity of the earth for future generations, we need a interdisciplinary and cross-sectoral approach to prevent diseases, and we need to have a better surveillance, monitoring, and control mechanisms, wherein we will be addressing the health concerns as well as the environmental conservation in a broader manner. So it urges the world nations that include the civil society and global health community to the first principle, recognize the essential link between human, domestic animal, and wildlife health and the threat disease pose to people. It says that we do require to maintain a healthy environment and a functioning ecosystem. At the same time, we need to think about adequate food supplies and an economic growth. So how we will try to balance a link between this human, domestic animal, and wildlife health. And the second principle recognizes that the whatever be the decisions that human beings take regarding land and water use would be having direct implication on health. The human impact can alter the ecosystem resilience, and this alteration can result in shifts in pattern of disease emergence, as well as the spread of diseases. Therefore, it is very important to recognize this link. And the third principle says we need to include wildlife health science as an essential component of global disease prevention, surveillance, monitoring, control, and mitigation. The fourth point says we need to recognize that human health programs can contribute to conservation efforts. Therefore, the fifth principle voices to devise adaptive, holistic, and forward-looking approaches for the prevention, surveillance, monitoring, control, and mitigation of emerging and resurging diseases. The sixth point is to seek opportunities to integrate biodiversity conservation perspectives and human needs while looking for solutions to infectious disease threats. The seventh point is on reducing the demand for and better regulate the international wildlife and bushmeat trade. This is not only to protect wildlife population, but also to reduce or mitigate the risks of disease movement. We need to realize the cost of this worldwide trade in terms of its impact on public health, agriculture, and conservation. Therefore, the global community should address this as a real threat because of its impact on the global socio-economic security. The eighth principle is on restricting the mass culling of free-ranging wildlife species for disease control, and says we need to have multidisciplinary international scientific consensus to consider that a wildlife population poses a very significant and urgent threat to human health and food security. The ninth principle calls for an increased investment in the global human and animal health infrastructure and calls for enhancing the capacity of global human and animal health surveillance and for a better information sharing. Because all these are essential for the coordination of responses among governmental and non-governmental agencies and other stakeholders. The 10th principle voices for the formation of a collaborative relationship among governments, local people, and the non-profit sectors. Because meeting the challenges of global health and biodiversity conservation cannot be the role of any one agency. The 11th principle is to provide adequate resources and support for global wildlife health surveillance networks that exchanges disease information with public health and agricultural communities as part of early warning system. And the final principle is on investing in educating and raising awareness among the world's people and in influencing the policy processes to increase this awareness and recognition that we must understand this relationship between health and ecosystem integrity Otherwise, our ultimate goal of a healthier planet would be at stake. So, from this Manhattan Principles, it is very clear that we cannot think of a single discipline or a sector to have adequate knowledge and resources to, to prevent the emergence or resurgence of the zoonotic diseases. No single nation can reverse a pattern of habitat loss or other larger biodiversity concerns, which will be having an implication for both people and animals. That is where we need to realize that we are in an era of one world, one health. And we need to, mold this one health as a better approach which can solve many of the challenges which we face today. Thank you.